good evening. Thank you so much for watching HealthLine here on PBS Fort Wayne. I'm Mark Evans, your host. Interesting topic tonight. In fact, we're hearing more and more about this if you keep your ear to the ground when it comes to medical things. It's about the prevalence and incidence of hepatitis C worldwide and in the U.S. And there are different types of hepatitis. We'll talk about those a little bit, and we're going to talk about why hepatitis C is in the spotlight on this show tonight. I have a very special guest. He's brand new to the PBS panel, and we hope to have him back already. I like this guy because we were talking in the green room before the show. He is Andrew Barcus, a nurse practitioner, and his specialty is infectious diseases. So thank you very much for spending time with us tonight.
I'm delighted to be here. Thank you, Mark.
So glad. So let's go ahead and I'm going to build the platform from the show because we have a, we have a phone number on the screen, and that is going to be up there throughout the show from time to time. Please call that. I'm talking to our viewers right now. Call that at any time during the program to ask questions that might arise as we're discussing things. Hepatitis C has become very prevalent here recently, and we're going to find out a lot about it this evening. So I'd like to go ahead and just find out what is hepatitis in general.
Yeah, that's a great question. Hepatitis is a generic term that we use for describing a situation where the liver is inflamed. And that can be caused by many things. It can be caused from certain medications that many people take on a daily basis, but also it could be from viruses. And that's really what I'm excited to discuss with you tonight.
Okay, and so it's mainly in the liver, a liver disorder.
That's right.
Okay, so how many types of hepatitis are there? I did a little research, and I think there's what, A, B, and C?
Yeah, so from a viral standpoint, there's hepatitis A, B, and C, and then there's D and a few others, actually.
Okay, so how are they different? You said viral, and then there's another type of hepatitis that is not viral.
Yeah, so hepatitis could be caused by medication, like we mentioned. Also, alcohol is a very important cause of hepatitis that's unrelated to a virus. So if we go to our primary care provider or health clinician and they tell us we have hepatitis, it doesn't really clarify what that actually means. It's not until we find out what's caused that type of hepatitis. So
a blood test is not going to tell you what type of hepatitis it is?
Eventually, it will. So to get some clarity on what type of viral hepatitis we have, it is a blood test that we would need to get that would tell us whether we have hepatitis A, B, or C.
Okay.
And hepatitis A is passed through contaminated food and water, which is very different than some of the other types of hepatitis.
Yeah, I knew somebody who had hepatitis A, and it was not a good journey for them.
Yeah, it can be a really intense situation. Not everybody gets terribly ill with hepatitis A, but many people do, and it can be very, very serious.
Right. Now, why is hepatitis C so prevalent now? Why are we talking about it this evening?
It's a great question. Historically, the treatments for hepatitis C have been fairly difficult. In some situations, it was more difficult than actually having hepatitis C. In the early stages, I should say, because there's different stages of hepatitis. There's an acute phase where we are exposed to the virus. We might feel ill, kind of like the flu, but after a week or two, we start to feel better, and we're none the wiser, right? And so that's why hepatitis C and B, for that matter, both hepatitis C and B are passed through contaminated blood and body fluids. So to that point, those are some pretty important distinctions to make. Mm-hmm. So if we're at risk for hepatitis C, we're also at risk for hepatitis B.
It's no big secret, I talk about it from time to time, but I do work in the funeral profession during the day. And we are required, if we work in various capacities, if you will, like preparing bodies and so forth for viewing, we're required to take hepatitis shots. And I certainly understand that, why we would have to do that.
Yeah.
So, and that's totally for prevention. So we're going to talk more about prevention down the road. But as far as hepatitis C is concerned, what are the stats? And the reason why we're talking about this is it has become a little bit more prevalent. And can you tell me what the stats are in the U.S. versus worldwide?
Yeah, so estimates are that there's over 50 million people living with hepatitis C worldwide, and then within the United States, between 2 to 3 million. And one of the most interesting facts about hepatitis C epidemiology is how many people who are living with hepatitis C actually are aware of that. In the United States, it's 50% of individuals living with hepatitis C are aware, roughly.
Are you kidding? The other 50% don't even realize they have it.
That's why I'm glad I'm here.
Yeah. Okay.
To talk some more about
there
that.
There we go.
But then worldwide, it's about 20% of people are aware of their status when it comes to hepatitis C.
And how are they getting this? And if you don't mind going through that again, because we do have various types of hepatitis.
Definitely, yeah. So hepatitis C is passed through blood and body fluids, primarily blood-to-blood contact. Very rarely could it be passed through sexual activity. It is possible, but generally, if there's any contaminated blood that comes in contact with our blood, then we're at risk for contracting hepatitis C. Now, and we'll talk some more about maybe we talk about risk factors now.
Okay.
So some pretty common risk factors would be sharing razors with somebody who's living with hepatitis C, toothbrushes. Actually, we don't often think about that, but in the middle of the night, if you grab the wrong toothbrush, or the morning, if the lights are out, there you go. But also if tattoos that are done at shops that are not FDA approved. I'm thinking more like home tattoos, where ink is shared, needles are not replaced every time. And then blood transfusions would also be an important risk factor pre-1992, 1993.
Okay.
So if we've had blood transfusions since that time, it's been screened.
Okay, very good. So that has improved.
Yes.
So right now it's the sharing of needles and the passage of various bodily fluids.
That's right. And if I could also add, Mark,
please.
If there's sometimes intravenous drug use is a very important risk factor that we'd want to make sure that we talk about.
Do you think that's one of the reasons why it has kind of boomed here lately?
It certainly has helped increase the numbers. And in 2020, in the United States, there were about 100,000 new infections. Another important reason to talk about this tonight.
Okay. Telephone number is 866-969-2720. We're live on PBS Fort Wayne tonight talking about hepatitis C with Andrew Barcus, a nurse practitioner specializing in infectious diseases. All right, so what are the complications related to hepatitis C once you have it?
So initially, most people do just fine. In fact, they don't feel like they have any medical problems, perhaps. The most common symptoms with hepatitis C are fatigue, and then some people will have headaches in addition to that. Sometimes people feel like they're walking around in a fog from time to time, so when we get people through treatment, sometimes they say, wow, I can't believe how bad I felt until we get them, or after we get them treated. Yeah.
And so is that a slow, ongoing process? I mean, you don't wake up one day going, I wonder if I have hepatitis or hepatitis C.
Most of the time, it's not like that at all, actually.
Okay. So it ramps up?
It can be a slow burn, yeah.
Okay.
In fact, it's the later stages of hepatitis C, when we've been living with it, maybe for decades. And that's when things really start to, the wheels start to fall off of things.
Well, for instance, our viewer watching right now thinking, I wonder if I have it. I mean, is that something that we should ask for when we go to the doctor the next time, maybe getting a blood test for it?
It's a great question. The recommendations actually are for folks 18 and above to be tested at least once in their lifetime. Also for pregnant women to be tested with each pregnancy. And if anybody has any known risk factors, which we kind of talked about tonight, any blood-to-blood contact, maybe a work exposure if you're in the healthcare field, needle stick injuries, things of that nature, then you would also want to be tested at those times as well.
So let me ask this again, only because I think it's very important. Who should be tested? So we're talking about pregnant women.
Yes.
Anybody over the age of 18.
Correct.
Any possible, not that it happens now, but maybe some drug use in the past.
Sure, absolutely.
And you said not necessarily sexually transmitted, but promiscuously, maybe in the past, you should be tested as well.
Yeah, that's why I've met with a number of individuals who come to me with advanced fibrosis, meaning their liver is very, very scarred to the point where they have cirrhosis. And that's how they find out.
What if somebody is a drinker
Yeah.
and they have hepatitis? Is that only going to complicate things and speed up the process?
That's right. When we have hepatitis C, or hepatitis B for that matter, but and we drink alcohol, we can really go through these stages of fibrosis, which are, basically that's a fancy term, a fancy way of saying our liver gets scarred really quickly. And when alcohol is involved, it can accelerate that.
Yeah. Okay.
Just
I could see how that would work. Yeah. All right. Well, we do have a call coming in right now. In fact, it's Molly, and she is preferring to be offline. Some of our viewers request that. They don't like the way their voice sounds or for various reasons. But she's asking, should the Hep C vaccine be required for public service workers? And that's really a good question. Thank you.
Yeah, that is a good question. Sadly, there is no vaccine for hepatitis C. We have vaccinations for hepatitis A and hepatitis B, but at this time there is no vaccine for hepatitis C. Another reason why it's in the limelight today because of the research that's going on with hepatitis C.
Yeah, and I knew, as I mentioned before, I did some research before the show, as I always do, and I was a little confused as to what there are vaccines for as far as hepatitis. Now, I don't want to get too far away from hepatitis C, but what are there vaccines for?
That's right. So hepatitis A, there's a vaccine for hepatitis A and hepatitis B.
For both of those,
Correct.
but not for C.
That's right.
Now, why is that? I mean, have they figured that out? Well, of course, if they figured that out, they probably have a vaccine, right?
Yeah, I know, right? I don't know that I could really give you a good answer for that, to be quite honest.
Okay. Well, we'll just be following the research on
I'll
that.
let you know. Next time I'm here, we'll talk about that.
Get back with me, will you? Okay. We're going to talk about current day treatments in just a moment, but what were the treatments like in the past?
Yeah, so hepatitis C, you can break it down into different subtypes. And depending on the subtype of hepatitis C you have, you may or may not have qualified for treatment. So we call those strains the genotypes. You don't need to remember that. However, certain genotypes you could treat, some you could not. And so that's another reason why this is such an important topic, because some people were told, sorry, you don't qualify. Now, times have changed. I'll tell you about the treatments first. One of them was called interferon, and this was an injectable.
I remember that.
Oh, yeah, okay, good, yeah. Well, not good, because it was so intolerable for a lot of people. It felt, folks had to get these injections once a week, and they would last somewhere between 6 and 12 months. And if you didn't tolerate it, but you were somebody that was very gung-ho about going through treatment, and you were committed to this, it was a year of, it was very difficult for you. And the only folks that really use that now are oncologists, as I understand. I've never actually prescribed interferon because it's kind of an older medication.
And what are the side effects of interferon?
Flu-like illness is the most common one. Body aches, headaches. We had to be screened by psychiatrists before we actually started that medication because it could exacerbate depression.
Oh, wow.
Yeah.
Wow. Okay, so that was treatment in the past.
Right.
Let's turn the page and get with the treatment currently.
Yeah. Yeah, this is one of the most hopeful parts of my job because the treatments are very well tolerated. The duration is much shorter than the interferon days. We can get somebody treated in as short as 8 weeks. 8 to 12 weeks is a standard course of treatment for hepatitis C, and we're really doing about 1 pill a day or just a few pills a day.
Oh, that's remarkable.
It's very, very different. Yeah.
The interferon, was that intravenous?
It was an injection.
An injection.
Yeah.
The pills, do they have any side effects that are quite common?
The most common side effect that I see in clinical practice, and that's been studied and recognized, is fatigue. Most of the time, though, fatigue is a common symptom of hepatitis C, so it's really difficult to tease that apart. But by and large, the medications are very well tolerated.
And are we seeing some progress? Are these new treatments working?
Very well, yes. The treatments that we have available, the cure rates are between 95 and 99%.
So it is curable?
Curable, to never come back.
Now, one of the hepatitis I, if you will, non-curable, correct? Is B non-curable?
Hepatitis B, we have medications to suppress it, but we don't have anything to cure it right now. But before 2014, there was just a lot of research going into hepatitis C treatments and cures and things, and we're seeing some of that kind of energy behind hepatitis B treatments.
I just find it amazing or fascinating that you have these different types of hepatitis. Yeah. Some are curable, some aren't. Some have vaccines and some don't.
Right.
It's just it seems like a very complex type of disease. And you got a core disease of hepatitis, right? And then what spins off into A, B, or C? Or am I simplifying it too much?
Hepatitis, they're fairly different strains of viruses, right? So one actually, hepatitis B in particular, it's a DNA virus. And so that acts differently than even an RNA virus. So DNA viruses, they can actually sometimes incorporate themselves into our liver's DNA. And that's why it's so difficult to extract that and get it treated. Hepatitis C doesn't have that same kind of investment in our liver, so to speak.
Mm-hmm. Well, pregnant women, if they have hepatitis, they're going to pass that on to their child?
Great question. Hepatitis C, estimates are that about 5% of women who are pregnant living with hepatitis C have the capacity to, well, they all have the capacity, but about 5% actually transmit to their children. Now, those numbers are being looked at currently, actually.
Okay.
Yeah.
Very good. Again, if you're pregnant, get tested.
Yeah, and your obstetrician, your women's health team may actually test you for that, or if you're meeting with your primary care provider, they'll probably be testing for that as well.
All right. We're talking to Andy Barcus, who is a nurse practitioner, specialty in infectious diseases, and tonight specifically talking about hepatitis and hepatitis C, which seems to be a lot more prevalent than it used to be. And here's a question for you. What if I've been treated before for hepatitis C and it just didn't work? Is this because I was treated with the interferon many years ago and it didn't work? What other variables are there?
Yeah, the cure rates with interferon, somewhere between 30 to 40 to 50%. So half the people that got treated with interferon didn't get cured. And it was a difficult thing. So, some people may be a little hesitant to go back and get retreated, but the medications today, very, 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 very tolerable. So if somebody has gone through treatment for hepatitis C and you haven't had that conversation with your healthcare provider and you aren't sure if you've been treated and cured, well, you know you've been treated, but if you aren't sure that you've been cured, then you would want to get in contact with your healthcare provider and ask them to run that test, and they'll know what test it is.
Good. Now, the treatments that are provided, not everybody is going to be tolerant of some of those. So what if, for instance, the pill that they have now would make me ill? Are there other alternatives, or are there some other medications I could take to help balance that out? Because if you've got something that's going to help treat hepatitis C, but that treatment is going to make me feel ill, what other alternatives do you have?
That's one of the obstacles that I hear from folks often is, I was not really ready to do that again. I wasn't ready to put myself in that position. And then it's really rewarding to be able to prescribe those medications for folks. And then they say that to me, this was not as bad. This was actually, I didn't realize I was taking a pill. That's another reason why I'm very excited about this, because so many people can tolerate this. And I think I've had about 2 people in the last, since 2015 that actually had to stop the medications due to side effects.
Yeah, and
pretty good odds.
Yeah, and you deal with a lot of people, so I guess those are really good odds.
Yeah.
Again, the telephone number is 866-969-2720. Get those questions in regarding hepatitis C. We've got about 5 minutes left in the program, so plenty of time maybe to answer a couple of questions. So call right now if you can. So how can we prevent getting hepatitis? Or let's start with hepatitis in general and then hepatitis C.
Yeah, so vaccinations for hepatitis A and B, everybody could get those. Those are available widely.
Now, why would you want to get one of those?
Yeah.
Because of the job you have?
If you work in the healthcare sector, then you're going to probably be required to have that vaccine before you even start working,
Right.
As you know in your field. Hepatitis A, we think more of like travelers, but we also see hepatitis A outbreaks here in the United States too. I think it was 2015, 2016 was the last outbreak of hepatitis A we saw here in Allen County. Health Department was very involved and did a great job of getting folks vaccinated who might have had some exposures.
If you have hepatitis C, for instance, and you end up getting COVID, what can you expect? What is that going to do? Any extra damage to your liver? I mean, how do those two diseases work together? And I'm sure you've seen some cases like that before.
Yeah, depending on the type of hepatitis, you don't expect those to really cause a robust, life-threatening situation like maybe it might sound, because I've seen many folks that have hepatitis C, and many people have had COVID, and just because we have hepatitis C doesn't mean that our COVID infection is going to be worse.
Mm-hmm. Okay.
So,
and what
question.
about the hygienic formalities, if you will? I'm trying to find the right mix of words. To prevent hepatitis C. I mean, are we talking a lot of hand washing? Don't kiss anybody. What kind of things can we do to prevent from getting hepatitis C, since it is kind of out there right now? Yeah.
So just a few things would be for hepatitis A, hand washing, absolutely. But in terms of hepatitis B and C, we can kiss our loved ones, we can hug them, we can use the same bathrooms, we can drink after them even, we'll get other things if we do that, but there's no risk of transmission of hepatitis B or C through casual contact or even some intimate contact. One thing I would want to stress that for those who actually might be injecting drugs, there's a syringe exchange program in Allen County, and that's one important way, because that's where the majority of the new infections are coming from, through intravenous drug use. And Allen County has really stepped up to provide that service.
Well, and earlier you were a little bit hesitant to talk about that, the drug usage, but I mean, it's obviously fact, and it's one of the reasons why we're sitting here talking about it right now, and that's the reason why it has become so prevalent. So hey, it's facts. We got to lay it out there, and that's what this show is all about. So, just if you have hepatitis, what should be if you have the symptoms of hepatitis, what should be going through your mind, and what should you be doing right away?
If you have late stages of cirrhosis, which would be like hepatitis gone to, you've had it for years, decades probably. You may experience jaundice, yellowing of your eyes and skin. You may experience some swelling of your abdomen. It's not the kind of swelling you feel after a big meal, but this is the kind of swelling that actually impedes your breathing, and it can cause you to feel like you just can't get a deep breath.
Because it's painful.
Well, there's just fluid in there,
see.
and it puts pressure on the lungs, and so you just can't catch your breath.
But you don't want to get to that point where it's like you wake up one morning and go, oh my gosh, my eyes and skin are yellow. So what other symptoms should you be looking out for? We talked about this a little bit at the beginning of the show, but I think since we've got a minute left, we should talk about this. When does that red light go off where it's like, I better get this checked out before that particular thing happens?
This is the scary part of hepatitis, because we can live for decades and decades and have no idea. And that's, again, if we get to those later stages where we have those symptoms we just described, then we're talking getting connected with a liver transplant team and things of that nature. That doesn't happen overnight. So I don't want people saying, oh my gosh, I have hepatitis C, I need to get this taken care of this minute.
That's why I brought this up.
Yeah, thank you for doing that.
Yeah. We don't want to freak out. Right. We just want to be able to control it, get it taken care of.
Yeah, because it can be 20, 30 years that someone's been living with this, just unawares. And then maybe their liver tests are off at their general practitioner's office, and they aren't sure. It could be a medication they're taking, but then they run the test, and lo and behold, it's positive. they can get in touch with that healthcare provider, and then they would refer them to somebody who can get the treatment going. And it's actually very accessible for folks, so I want to make sure that that comes through loud and clear. Insurances are covering the medications very well, and we can get most folks cured, about 95 to 99% of folks.
Well, I'm so glad you came on tonight and talked about this. It has been some questions wavering out there for me about this as well, and I'm sure that we answered many for our viewers tonight, and that's exactly why we're here. And we thank you very much for being here tonight, Andy.
Oh, thank you so much.
All right, please come back again. We'll talk more about infectious diseases when you return.
Sounds great.
In the meantime, you return next week, Tuesday night, 7:30 for more HealthLine. Until then, thanks for watching. Good night, good health.
The preceding program on PBS Fort Wayne was made possible in part by
Momentum, progress, innovation. Parkview Health knows standing still isn't an option. We must learn, grow, excel, and actively work to advance healthcare for our community and beyond. With technologies that improve access to care and teams of specialized providers, we are moving healthcare forward. Right here at Parkview Health.